Hi, hello everyone. Welcome to Dr. Ravichandra Official. Please like, share, and subscribe Dr. Ravichandra Official. In the last episodes, in one of the video, I have discussed the MBBS General Pathology and Hematology KNRUHS MCQ January 2025 MCQs. So in this video, I'm going to discuss the MCQs that were being given in the KNRUHS MBBS exam in January 2025 Systemic Pathology. Let's start the video. In Barrett's esophagus, there is hyperplasia of epithelium, metaplasia of squamous epithelium, neoplasia of sq- lower third of the esophagus, dysplasia of the lower third of the esophagus. The answer is metaplasia of the squamous epithelium. Actually, Barrett's esophagus is a condition in which the normal squamous epithelium lining the esophagus is replaced by a metaplastic columnar epithelium, often as a result of chronic gastroesophageal reflux disease. This metaplastic change increases the risk of developing the esophageal adenocarcinoma. Next question. Three-bar-like calcification in chest X-ray is seen in A. Progressive tuberculosis, B. Secondary tuberculosis, C. Miliary tuberculosis, D. Primary tuberculosis. The correct answer is primary tuberculosis. Tree-bark-like calcification in a chest X-ray is a characteristic feature of primary tuberculosis, and particularly in the context of the Gons complex or primary complex. This type of calcification is often seen in the hilar nodes or paratracheal lymph nodes. Gons complex is a characteristic feature of primary tuberculosis, and it consists of primary lesion in the lung, lymphatic spread to hilar or paratracheal lymph nodes, calcification of the primary lesion and affected lymph nodes, resulting in the tree-bark-like appearance. Coming to the third question, the commonest type of pericarditis in acute rheumatic fever is A. Serous, B. Fibrinous, C. Serofibrinous, D. Purulent. The correct answer is fibrinous. In acute rheumatic fever, the most common type of pericarditis will be fibrinous pericarditis. This type of pericarditis is characterized by there will be fibrin depositions on the pericardial surface. Bread and butter pericarditis is fibrin deposits resembling the bread and butter. So, bread and butter pericarditis or fibrinous pericarditis is seen in acute rheumatic fever. It is often associated with a pericardial friction rub, which is a characteristic clinical finding in the acute rheumatic fever. Coming to the next question, all are features of complete hydatidiform mole except option A karyotype 46XX, option B serum HCG is markedly increased, option C trophoblastic proliferation is focal, and option D atypica is often present. So, which is the correct answer? Any guess? Option A karyotype 46XX, option B serum HCG markedly increased, option C trophoblastic proliferation is focal, option D ATPI is often present. Yes, the correct answer is trophoblastic proliferation is focal. In a complete hydatidiform mole, trophoblastic proliferation will be typically diffuse and circumferential, not focal. The other options are characteristic features of a complete hydatidiform mole, karyotype 46XX. Complete moles usually have a 46XX karyotype resulting from the fertilization of an empty ovum by a single sperm that will duplicate its DNA. Serum HCG will be markedly increased. Option B. The complete moles will have producing high levels of HCG or human chorionic gonadotropins, leading to markedly elevated serum HCG levels. Coming to the option D, ATPA is often present. Complete moles often exhibit cellular atypia characterized by irregular nuclear shapes, sizes, and staining patterns. So, the answer for this question is trophoblastic proliferation is focal is the answer according to this question. Coming to the next question, fibroadenoma. The etiology is option A increased estrogen, option B increased progesterone, option C increased testosterone, option D all of the above. The correct answer is increased estrogen. You know, fibroadenoma is a common benign breast tumor and it is thought to be related to hormonal influences, particularly estrogen. The exact cause is not fully understood, but it is believed that estrogen will stimulate the growth of the breast tissue, leading to the development of the fibroadenomas. And these fibroadenomas are the most commonly seen in young women, typically during their reproductive years, which further supports the role of estrogen in their development. Coming to the next question. Which of the following is not in Cushing's syndrome? Option A, central obesity. Option B, glucose intolerance. Option C, buffalo hump. Option D, hyperpigmentation. The correct answer is hyperpigmentation. Hyperpigmentation is more commonly associated with Addison's disease, which is a condition characterized by adrenal insufficiency. And the decreased production of cortisol will lead to an increase in adrenocorticotropic hormone ACTH, which will stimulate the melanin production, resulting in hyperpigmentation. The other options that were given in the question are characteristic features of Cushing syndrome. Here in this question, they have asked which of the following is not in Cushing syndrome. So the answer is hyperpigmentation. Central obesity, accumulation of fat in the abdominal area. Glucose intolerance is impaired glucose metabolism due to excessive cortisol. And buffalo hump is accumulation of fat between the shoulders. Coming to the next question. All are true about pyogenic meningitis except A. Increased CSF protein. Option B. pleocytosis. Option C. Markedly decreased CSF glucose. Option D. Decreased CSF C-reactive protein. The correct answer is decreased CSF C-reactive protein. In acute pyogenic meningitis, C-reactive protein, that is CRPs, levels in the cerebrospinal fluids are typically increased, not decreased. And C-reactive protein is an acute phase protein that will rise in response to inflammation and infection. Coming to the other options are true. Increased CSF protein will be there in pyogenic meningitis, leading to the increasing permeability of the blood-brain barrier that will result in elevated protein levels in the CSF. Pleocytosis. Acute pyogenic meningitis is characterized by an increased number of white blood cells, which is called as pleocytosis in the CSF. Markedly decreased CSF glucose. Bacterial meningitis can lead to decreased glucose levels in the CSF due to bacterial consumption and impaired glucose transport. Coming to the next question, that is eighth question. Modifiable major risk factors for atherosclerosis includes the following except obesity, hyperlipidemia, hypertension, cigarette smoking. The correct answer is obesity. While obesity is a risk factor for cardiovascular disease, it is not considered one of the major modifiable risk factor for atherosclerosis. The major modifiable risk factors for atherosclerosis are hyperlipidemia, hypertension, cigarette smoking, and diabetes mellitus. Hyperlipidemia is high levels of LDL cholesterol and triglycerides. Obesity is a contributing factor to these major risk factors, but it is not considered one of the primary modifiable risk factors for atherosclerosis. Coming to the next question. This is a clinical question. A 50 years old man had progressive dyspnea on exertion and fatigue in the last 2 years. On auscultation of his chest, he has a prominent pulmonary component of S2, a systolic murmur of tricuspid insufficiency, and bruits over the peripheral lung fields. Laboratory studies showed antiphospholipid antibodies. CT angiogram or CT angiography showed eccentric occlusions with pulmonary arteries and mosaic attenuation of the pulmonary parenchyma. What is the most likely disease process causing his pulmonary disease? Option A, atherosclerosis. Option B, pneumonitis. Option C, sarcoidosis. Option D, thromboembolism. The correct answer is thromboembolism. The patient symptoms, physical examination, and diagnostic findings are suggesting of chronic thromboembolic pulmonary hypertension. The key features that will support this diagnosis are progressive dyspnea and fatigue, prominent pulmonary component of S2, systolic murmur of tricuspid insufficiency, bruits over peripheral lung fields, presence of antiphospholipid antibodies, which is a hypercoagulable state. CT angiography is showing eccentric occlusions of the pulmonary artery and mosaic attention of pulmonary parenchyma. These findings are consistent with the disease chronic thromboembolic pulmonary hypertension, which is characterized by chronic thromboembolic obstruction of the pulmonary arteries leading to pulmonary hypertension. Coming to the last but not the least question, the most common tumor of appendix is adenocarcinoma, benign carcinoid tumor, GIST, gastrointestinal stromal tumor. Option D, lymphoma. The correct answer is benign carcinoid tumor. Carcinoid tumors are the most common type of tumors found in the appendix, and they account around 80 to 90% of all the appendiceal tumors. Most of these tumors are benign and are usually discovered incidentally during the surgery for appendicitis. Coming to the other options, adenocarcinoma. Adenocarcinoma is a malignant tumor that can occur in the appendix, but it is much less common than the carcinoid tumor. So, the most common tumor of the appendix is benign carcinoid tumor. Thank you for patient listening. Please like, share, and subscribe Dr. Ravichandra Official for more interesting videos. I am sharing the link for the general pathology and hematology MCQs that were being given in the KNRUHS MBBS January 2025 exam also. Please like, share, and subscribe Dr. Ravichandra Official.